Have you ever wondered why we can't hold our breath forever? It's because of the remarkable, tireless work of our respiratory system, with our lungs playing the lead role. This intricate system works non-stop, even as we sleep, to keep us alive and functioning. The primary function of our lungs is to transport oxygen from the inhaled air into our bloodstream, and to remove carbon dioxide, a waste product of metabolism, from our body during exhalation. This process of gas exchange is crucial for maintaining the delicate balance of oxygen and carbon dioxide levels in our blood, which is vital for our survival. Additionally, our lungs also serve as a protective barrier against infections, filtering out harmful particles and microbes from the air we breathe. But what if this protective shield is breached? What if our lungs become the battleground for an infectious disease? Let's explore what happens when this protective barrier is breached. When a foreign pathogen overcomes the lung's defense, we get pneumonia. This inflammatory condition primarily affects the air sacs or alveoli of the lungs, filling them with fluid or pus, which can lead to difficulty breathing, fever, chills, and cough with phlegm or pus. Let's delve into the different types of pneumonia, classified based on where or how the infection was acquired. First, we have community-acquired pneumonia, or CAP, the most common type. This occurs outside of hospitals or other healthcare facilities, often caused by bacteria, the most common being Streptococcus pneumoniae. Then there's hospital-acquired pneumonia, or HAP. This develops during a hospital stay for another illness. It's typically more serious than CAP because it's caused by bacteria that are more resistant to antibiotics. Lastly, we have aspiration pneumonia. This happens when you inhale food, drink, vomit, or saliva into your lungs. It's more common in people with a compromised gag reflex or who use medical devices like ventilators. Despite their differences, these types share a commonality. They all involve the invasion of a foreign pathogen into the lungs, triggering an inflammatory response. The body's attempt to fight off the invader leads to the symptoms we associate with pneumonia. But not all pneumonias are created equal. For instance, bacterial and viral pneumonias present differently and require different treatments. Bacterial pneumonia, which is often more severe, typically causes symptoms like high fever and rapid breathing. Viral pneumonia, though usually milder, can serve as a precursor to bacterial pneumonia. And then there are the atypical pneumonias, which don't fit neatly into these categories. They're caused by different types of bacteria and have a wider range of symptoms, sometimes making them harder to diagnose. Understanding pneumonia types helps medical professionals prescribe the right treatment. But what causes pneumonia? Well, pneumonia can be caused by a variety of pathogens, including bacteria, viruses, and fungi, each with unique characteristics and treatment needs. We'll explore these in our next scene. Stay tuned. Pneumonia isn't caused by a single villain. It has a rogues gallery of culprits. The pathogens responsible for pneumonia are as diverse as they are dangerous, and they can be broadly categorized into three groups: bacteria, viruses, and fungi. Let's start with bacteria, the most common cause of pneumonia. Streptococcus pneumoniae, also known as pneumococcus, is the usual suspect. This crafty bacteria can dodge our immune system and settle in the air sacs of our lungs, causing inflammation and infection. Another bacterial culprit is Haemophilus influenzae, a misnomer as it doesn't cause influenza, but can lead to bacterial pneumonia, especially in people with chronic lung conditions. Next up, the viral villains. Influenza viruses, commonly known as the flu, can cause viral pneumonia. Other viruses like respiratory syncytial virus, or RSV, and severe acute respiratory syndrome coronavirus 2, the cause of COVID-19, can also lead to pneumonia. Viral pneumonia typically starts as an upper respiratory tract infection before it descends into the lungs, causing inflammation and damage. Lastly, we have the fungal foes. Fungi like Pneumocystis jirovecii can cause pneumonia, particularly in people with weakened immune systems. Other fungi like histoplasma found in bird and bat droppings or coccidioids found in soil in certain regions can be inhaled and lead to fungal pneumonia. These pathogens, whether bacterial, viral, or fungal, have one thing in common. They invade and infect the lungs. They can spread through the air when someone with the infection coughs or sneezes, or they can be transferred from contaminated surfaces. Once in the lungs, they multiply and cause inflammation, leading to the symptoms we associate with pneumonia: cough, fever, and difficulty breathing. Identifying the pathogen is key to treating pneumonia, but who is more susceptible to this disease? Understanding the pathogen involved not only helps in the treatment of pneumonia, but also in its prevention. So remember, knowledge is power, especially when it comes to our health. Not everyone is equally vulnerable to pneumonia. Some factors increase the risk. An individual's age plays a significant role in their susceptibility to pneumonia. Infants and people over the age of 65 are more likely to contract the disease due to their often weaker immune systems. Speaking of immune systems, those with immunosuppression, whether from diseases like HIV or treatments such as chemotherapy, are also at a higher risk. Then there's environmental exposure. Those who are frequently exposed to pollutants, smoke, or certain chemicals may have their lung function compromised, making them more prone to infections. People in crowded institutions like nursing homes or schools are also more likely to contract pneumonia. The risk can also increase due to lifestyle factors such as smoking or heavy drinking, as these habits can damage the lungs' natural defenses against bacteria and viruses. Knowing the risk factors can help in prevention. But how does pneumonia develop in the lungs? Pneumonia is like a wildfire in the lungs. It starts small and then spreads rapidly. Imagine a tiny pathogen, a bacteria, a virus, or even a fungus, invading your respiratory system. Once these pathogens bypass the body's initial defenses, they settle in the alveoli, the tiny air sacs in the lungs, and start to multiply. This invasion triggers an alarm, activating the body's immune system. White blood cells rush to the scene, causing inflammation in the lungs. This inflammation, while necessary to fight off the intruders, also leads to fluid accumulation in the alveoli. The air spaces that were once filled with oxygen are now filled with pus and fluid, making breathing difficult and oxygen exchange inefficient. The infection can spread rapidly within the lung, damaging lung tissue and causing respiratory distress. This is the terrifying progression of pneumonia, a condition that starts as a minor irritation but can quickly escalate into a life-threatening situation. Pneumonia's development is a complex process, but how can we recognize it? Recognizing pneumonia early can be the difference between a quick recovery and a serious illness. Pneumonia often begins subtly, with symptoms that may be mistaken for a common cold or the flu. However, as this lung infection progresses, the symptoms become more severe and distinct. Fever is a typical sign, often accompanied by chills or sweating. The body's temperature rises as it attempts to fight off the infection. Persistent coughing is another hallmark symptom, sometimes producing mucus that may be green, yellow, or even bloody. Chest pain is also common in pneumonia patients. This pain often worsens during coughing or even deep breathing, as inflamed lungs and the surrounding muscles work overtime. Shortness of breath, too, is prevalent as the lungs struggle to draw in sufficient oxygen. Patients may also experience fatigue, confusion, especially in older adults, and a loss of appetite. In some cases, pneumonia may alter the breath sounds that a healthcare professional can hear during a physical examination. These could include crackling, bubbling, or rumbling sounds. Diagnosing pneumonia involves a thorough evaluation of these symptoms along with a series of tests. A physical examination can reveal decreased breath sounds, areas of dullness, or enhanced vibrations in the chest. Chest X-rays are invaluable in confirming the presence of pneumonia and its location within the lungs. The X-ray can show areas where infection has filled the air sacs with fluid or pus, appearing as dense, shadowy patches. Laboratory tests can help identify the specific pathogen causing the infection. A sputum test, for instance, involves analyzing mucus coughed up from the lungs. Blood tests can check for the presence of bacteria or viruses in the bloodstream. In some cases, a bronchoscopy may be performed. This involves inserting a thin tube down the throat to visually inspect the airways and collect lung secretions or tissue samples. In conclusion, the symptoms of pneumonia are varied and can progress from mild to severe quickly. Recognizing these signs and seeking medical attention promptly can lead to an early diagnosis. Early diagnosis is crucial for effective treatment, but what are the treatment options? Treating pneumonia is not a one-size-fits-all approach. It depends on the cause and severity. let's delve into the different treatment options available. Starting with bacterial pneumonia, the mainstay of therapy is antimicrobial medications. These are designed to kill or inhibit the growth of the bacteria causing the illness. The choice of which antimicrobial to use is generally guided by the suspected type of bacteria, the patient's health status, and local antibiotic resistance patterns. Some commonly used ones include penicillins, macrolides, and fluoroquinolones. In severe cases, a combination of antibiotics may be used to ensure a broad spectrum of coverage. Now, what if the pneumonia is caused by a virus? Here, antiviral medications come into play. These drugs work by inhibiting the reproduction of the virus, hence limiting its spread within the body. For influenza-related pneumonia, for instance, antivirals like oseltamivir or zanamivir can be prescribed. In the case of COVID-19-related pneumonia, remdesivir is a possible option. On to fungal pneumonia, and the treatment here is, you guessed it, antifungal medications. These work by disrupting the growth of the fungi, giving the body's immune system a chance to clear the infection. Depending on the type of fungus involved, medications such as fluconazole, itraconazole, or amphotericin B might be used. But sometimes pneumonia can be caused by more than one pathogen, or the causative agent might be unknown. In such situations, a broad-spectrum antibiotic, which is effective against a wide range of bacteria, may be used initially. The treatment can then be adjusted once the results from the diagnostic tests are in. Remember, these treatments are often used in conjunction with supportive care. This could include oxygen therapy to ensure adequate oxygenation, fluids to prevent dehydration, and medications to manage symptoms like fever and cough. In conclusion, the treatment of pneumonia can be quite complex, with the choice of therapy being tailored to the individual patient and the causative agent. Choosing the right treatment is a critical step. But what role does patient evaluation play in this? Patient evaluation is not just about diagnosing pneumonia, it's about managing it effectively. A key pillar in managing pneumonia is thorough patient evaluation. This involves a comprehensive understanding of the patient's history, their symptoms, and the results of various diagnostic tests. This holistic approach helps to tailor treatment strategies that are both effective and personalized, ensuring optimal patient outcomes. One essential tool in patient evaluation is sputum analysis. This simple test can provide valuable information about the type of organism causing the pneumonia. It involves studying a sample of mucus coughed up from the lungs, which could contain bacteria, viruses, or fungi. This analysis helps to guide the choice of antimicrobial therapy, making it a vital part of the evaluation process. Blood cultures are another critical component of patient evaluation. By studying the patient's blood, we can identify if the infection has spread beyond the lungs. This is particularly important in severe cases of pneumonia, where the infection can lead to sepsis, a life-threatening condition. Bronchoscopy can also play a role, especially when standard tests don't provide clear answers. This procedure allows direct visualization of the airways and collection of samples from the lungs. While more invasive than other tests, it can be instrumental in diagnosing atypical or difficult-to-treat cases of pneumonia. But patient evaluation isn't just about diagnosing the disease. It's also about monitoring the patient's condition and managing complications. This is where oxygen therapy and supportive care come in. Oxygen therapy can be life-saving in cases of severe pneumonia where the lungs aren't able to provide enough oxygen to the body. Supportive care, which includes hydration and pain management, is crucial in helping patients recover and maintain their strength during treatment. In conclusion, patient evaluation is a multifaceted process that goes beyond diagnosis. It involves a comprehensive understanding of the patient's condition, guided by a range of diagnostic tests. It also includes the management of complications and supportive care to assist recovery. Patient evaluation is the cornerstone of effective pneumonia management. It helps guide treatment and improve patient outcomes. Pneumonia is a serious lung infection that requires prompt attention and treatment. This statement underscores the gravity of the condition we've been discussing. Pneumonia, an infection that inflames the air sacs in one or both lungs, can be caused by various pathogens, including bacteria, viruses, and fungi. We learned that it can be classified into community-acquired, hospital-acquired, or aspiration pneumonia. each with its own unique set of challenges and treatment approaches. Our respiratory system, particularly our lungs, play a vital role in our overall health. When the balance within this system is disrupted, conditions like pneumonia can occur. Risk factors such as age, immunosuppression, and environmental exposure can increase an individual's susceptibility to this infection. We also delved into the inflammatory response in the lungs and how this leads to the development of pneumonia. We differentiated between typical and atypical pneumonia, understanding that the symptoms, severity, and treatment can vary between these types. The diagnosis of pneumonia involves a range of strategies, from physical examination, chest x-rays, to laboratory tests. Sputum analysis, blood cultures, and bronchoscopy can provide valuable information to confirm the diagnosis and guide treatment. Symptoms such as fever, cough, chest pain, and breath sounds are key indicators of the infection. We explored various treatment options, including antimicrobial therapy for bacterial pneumonia and antiviral or antifungal treatments for specific cases. The importance of patient evaluation was emphasized, as well as the role of oxygen therapy and supportive care in managing the illness. In summary, pneumonia is a complex condition that demands a multifaceted approach. It requires a thorough understanding of the respiratory system, a keen eye for symptoms, precise diagnostic strategies, and appropriate treatment plans. Understanding pneumonia is the first step in fighting it. As medical professionals, it's our job to stay informed and provide the best care possible. Let's continue to build upon our knowledge and strive to improve health outcomes for those affected by pneumonia.